In Botswana, almost 22% of the population lives with HIV. This is a real public health challenge that affects people's lives, in their families, at work, in communities. Back in 1996, the situation among our Botswana employees was alarming. A voluntary HIV test survey showed that around a third of them were HIV positive. The disease had a dramatic impact on those affected, including loss of income, early retirement, and sadly, loss of lives. In response to this situation, Botswana started developing an innovative HIV disease management program, the first workplace-based initiative of its kind anywhere in the world. The program was launched in 2001 with a focus on prevention, treatment, care and support for employees. At that time, De Beers and Botswana, followed by Namdeb in 2002, were among the first companies to offer free antiretroviral treatment. The program has been running ever since, and we have consistently explored new ways to make a measurable difference in the lives of our employees. Our prevention work includes educating at all levels of the organization to inform people about their choices regarding HIV prevention and treatment. Counseling and testing is available to all employees and contractors, and in many cases, counseling and testing is extended to families and members of the community. We provide free antiretroviral treatment to HIV-positive employees, their life partners, and in Botswana, Namibia, and South Africa, this has now been extended to employees' children. Today, there are more than 1,300 people on our programs who are registered to receive free antiretrovirals. We provide support and guidance to employees and their families on health or social issues, including HIV. Employees living with HIV continue to receive ongoing counseling about adherence, care, and support. Our Employee Assistance Program extends psychological well-being support to employees and spouses infected or affected by HIV. Today, the program has made a measurable difference in the lives of our employees. Loss of life related to HIV dropped from around 30% in 1996 to less than 1% in 2014. More than 85% of our colleagues living with HIV are registered on the HIV Disease Management Program. More than 90% of those on the program now lead healthy and productive lives. This has also made a material difference to our business, with happier and more productive employees and reduced absenteeism. But we're very conscious that there is much more to be done. We are thinking of new ways to increase our impact. Going forward, it will mean joining forces with others. We are creating innovative public-private partnerships in Botswana, Namibia, and South Africa to support community HIV projects. We continue to build relationships with communities, governments, and international agencies dealing with HIV to ensure that lessons learned are shared and successful models are replicated. Ultimately, we believe that zero HIV deaths, zero new infections, and zero stigma is achievable. And we're more determined than ever to realize this ambition.